Hi audience, Moise Mirondo from Uganda, present to you our innovation entitled Village Mobile Rehabilitation Program, which is partially funded by Go Youth 2022. Our innovation is motivated by the fact that about 2.5 million children in Uganda are living with disabilities, and this accounts for 5% of the entire population. And moreover, only 30% of Uganda districts have physiotherapists, and you may find you have one or two in a district of up to 50,000 people. It's true that early intervention programs for children under the age of 6 with development delay are vital for improving long-term functionality, according to the World Health Organization. But the situation in Uganda is that up to 85% of the children in Uganda below the age of 6 have no access to early intervention therapy. This is due to the limited number of specialized people, but also the fact that most of these people are living in remote places, which leads to high costs in terms of transportation. But there's also a big problem of society stigma, where such people, children are seen as less of children, where the disabilities are attributed to witchcraft, misfortunes or curses from ancestors. Most of the time, these children are locked up in houses. Given that complex situation, we come up with a proposal in terms of a solution which integrates phone application, complementing face-to-face community engagement. In brief, the solution works as follows. The children are screened at health centers, nursery schools for signs and symptoms, delayed development, and the children that are turned positive are assessed by our team of specialists, which information is captured into the phone application to come up with a therapy plan for each child. And this is information which is captured by the community rehabilitation workers to provide EI therapy at the children's own home. It's important to note that these rehabilitation workers are not professionals, but these are people we choose from the community and we train to equip them with the necessary skills in order to be able to administer the early intervention therapy. The solution also involves impact evaluation and management in order to assess the impact and progress of our interventions at different stages. In terms of application, the phone, we do the capture of the data of the children. We have to capture the medical history of those that are not positive. We have to capture the therapeutic plan. We have to capture the information necessary for monitoring the compliance with the plan. We have to capture information which is needed for awareness and creating education for the parents and the people in the community so that they're able to deal with the children, even the absence of community rehabilitation workers. In terms of output, we've seen an increase in terms of children being screened, in terms of number of health workers being trained, and in terms of people who are being given the therapy. So what has been our impact? Our self-assessment has revealed that we've had a positive impact to the community in terms of decreased strain on the parents, increased engagement between parents and their disabled children, and also between the disabled children and those in the community. And we've seen an increase in terms of enrollment in schools. Because remember, we said previously, these children were seen as a disgrace. They were keeping them in houses. But now parents believe that this can also become important people in communities, such as ministers, such as engineers. Our solution is unique to the fact that we incorporate participation of the entire chain from the family of the disabled children, the community through the rehabilitation workers, and the trained specialists. Moreover, we integrate technology with already established structures within the society. Our plan is to scale up the enrollment, to look for more funding, and also to bring in more NGOs in order to expand our intervention. Moreover, we also target to establish a training, a resource center where people can always meet and interact and create awareness. In terms of business model, we didn't seek out to get money from our intervention because we are dealing with people who are marginalized, people who are not blessed enough, people who have no resources. So we are doing this based on simple donations from well-wishers and voluntary services from the community resource workers, and sometimes those specialized therapists. We can be reached on those WhatsApp numbers, and in case of donations, we could be reached on those account numbers. Let's come together, let's put our hands together in order to support those that are marginalized. You can buy a bicycle to transport the people, or to serve as an ambulance, and you can also buy a bicycle to facilitate the community, the movement of the community rehabilitation workers. Our team is made up of people from different academic backgrounds and disciplines. What puts us together is the need or the willingness to help or the desire to help those that are in need. Thank you.